Good morning. This is the Valdra Beebe Show live out of Dallas, Texas. How are you, Dr. Khan?
Very good, Valder. Thanks for having me.
I've only got a little time with you. I wish I had a lot more time, but we're going to talk about a 2026 health checklist for seniors. And I've got a couple questions, and maybe you can help make sense of them. How about that?
Let's jump in.
All right. So they want me to ask you about making an appointment for both your annual wellness and your annual physical with your primary care physician, including full blood work. The questions that I have that they gave me, your team, this is for people who are totally cognizant to do this. And I know some seniors who are not, and it seems like there's no room for those people who are not very cognizant in doing this. But we're going to go ahead and go with this, that hopefully most of the cognizant people are listening. So how about making that appointment for both your annual wellness and your appointment for your blood work? How does that work?
Well, I'd say for the folks, whether both the cognizant and the non-cognizant, I think it's equally important, right? That those appointments are the foundation of the kind of preventive health that keeps us healthier and keeps us, stably as much as possible, happy, healthy at home for as long as possible, right? That's why Medicare Advantage plans like ours cover those at no additional cost because of how important we think those are, right? Whether it's that annual wellness visit, that's the playbook, setting the playbook for the whole year of here's what we want to do month by month to make sure that you're staying healthy, that we're looking for signs of anything new on the horizon, or whether it's that comprehensive physical that's doing more than just a physical exam, but it's getting the blood work, getting the other imaging, doing the other screens, maybe administering the vaccines that catch problems early before they get worse or before they get to a place where they might need a hospitalization, right? That's the goal. The goal is building a foundation for health for not only this year, but for many years to come. And I just couldn't emphasize enough that getting this done at the start of the year, we're already in February, sets you up for success year round.
Today I'm talking with Dr. Ali Khan. He's a practicing general internist and a chief medical officer, Medicare at Aetna, a CVS health company. Dr. Khan, you said get your eyes checked, your hearing checked. Tell me about these issues and addressing them early.
So this is, you hit on one of my real passions that I love to talk about anywhere I go and with any patient I see. So, our memory, our cognition, the questions about dementia, these are things all of us hear about all the time, right? Whether we're talking with our parents or our family members, whether I'm talking to my own doctors, right? Everywhere we look, this is a question. And one of the most effective things we can do after we turn 60 is getting annual hearing tests and annual vision tests, checking those eyes and ears thoroughly to make sure that we're not missing any signs of early hearing loss or early visual changes. And why is this important? Because when we don't pick up on that early hearing loss, people start to go into themselves, right? They can't hear conversations. They start withdrawing socially, and they start getting into positions that over time leads to memory degradation and potentially even dementia. Same thing from a visual perspective, right? Voracious readers and folks who are watching programming and engaging with culture and society suddenly can't see anymore. They can't drive. They're not as mobile as they used to be because of that visual issue. Their social interaction goes down. We see memory challenges, right? So the biggest thing we can do, and one of the core parts of my personal checklist, is getting those screens done every single year, again, at no cost from your health plan because of how important we think those are, and setting yourself up for a long run of staying sharp, staying cognizant, to your great point at the start of our interview, and staying as healthy as we can be for as long as possible.
Okay, as I wind up, and I'm sure you have no power, but I have none, definitely. But when is the American health care system going to stop taking the burden off of us as the patient and maybe take some responsibility for companies like yours that offer the plan or our government? Because I was looking, I knew you were coming on. I was looking at just arbitrarily American health care plan versus a plan in Norway. I'm telling you, we fall very short, doctor. I mean, like really just out-of-pocket expenses. They have a cap on fees, and then most of the care is free after the cap. We have no universal cap unless you buy a supplemental plan. That's just one example. So all the things you and I talked about, that puts it on us to do, but you never say, like, we're going to call you and remind you, get your annual vision, your hearing, that thing, and take some of the responsibility off the non-cognizant people.
Right. And I think this is where I think we all acknowledge affordability and advocacy are two really critical pieces of how we make sure everybody can stay happy and at home, right? And I think this is where understanding your benefits, right, when you sign up for a Medicare Advantage plan is so important, because a lot of times people will say, "Oh, Aetna's calling me again," right? But in this case, Aetna might be calling you to say, "Hey, you qualify for an intensive program where we will call you and we'll send community health workers to your house to help you with navigate your diabetes, and this is at no cost to you," right? But we live in a society where we see a health plan calling, or we see a doctor's office calling, we assume it's about a bill, right? Because again, to the very good points that you just raised earlier about how we think about financing in this country. So what I can tell you is, both from my clinical lens and from the Aetna lens, we are all trying to make sure that we are filling in the gaps in American healthcare, being proactive with you and getting you the support that you need, which is why we're investing in digital portals and apps that make sense, that to give you the information that you need to have, right? Which is why we've built these additional benefits and additional programs to make sure that we're filling in the gaps that can exist in any healthcare delivery system. And what we want to do is empower you to make sure that you're aware that we're there, so that when you see Aetna calling, you're like, "Oh, they might be calling because I just got out of the hospital," not, "They're probably calling about another bill." And when we get that right, when we get that trust right, to your great point, that's when we all win around health.
A place online for my audience to go and get more information?
Lots of great links out there. My personal favorite, no surprise, aetnamedicare.com. A great place for unbiased information about what's available to you, what you're owed, and how to get more information about what a healthy journey looks like for everyone.
Dr. Ali Khan, this has been very revealing and very, very informative. Thank you for stopping by the Valder BB Show.
Thank you so much for having me, Valor.